ability to pick up these things really quickly. I mean, 20 cases in the UK, but they're being picked up through excellent networks. If we saw 20 cases of anything else, we might not even spot it. So we have to be really thoughtful about the fact that although it appears to be a spike, we don't know how things are going to unfold yet.
Doctors are warning that monkeypox could have a massive impact on access to sexual health services. It's reported that staff at clinics are already having to isolate if they have come into contact with anyone infected. Well, let's speak to Dr. Matt Phillips, sexual health consultant from the British Association for Sexual Health and HIV. Good morning.
Good morning.
We were talking to a doctor earlier on. We've spoken to people on Times Radio over the last few days, talking about why is it in particular it seems to be affecting gay men and bisexual men. Do you have any thoughts on why that would be?
Yeah, thanks. I mean, that's the question that's lingering in the air at the moment. It's not completely clear at all why we're seeing the cases amongst the group that you have described. But we do have to be cautious around thinking about the people who've been affected so far. It's just that that's the first place that we've seen it. So, and it's very early days, still only double figures reported of cases. So we have to be careful not to pick up on that too much yet.
And do we have any idea why there is this spike? I mean, we know that monkeypox is quite common in certain parts of Africa, particularly there have been many cases I know in the past in Nigeria. But why are we getting a spike across Europe, it seems?
Again, really early days, and it's so difficult. I think what we have to pay attention to is our ability to pick up these things really quickly. I mean, 20 cases in the UK, but they're being picked up through excellent networks. If we saw 20 cases of anything else, we might not even spot it. So we have to be really thoughtful about the fact that although it appears to be a spike, we don't know how things are going to unfold yet.
And when we're talking about access to sexual health services, I was reading this morning that some clinics are actually stopping in walk-in patients because of concerns over staff becoming infected. Is that a real danger?
It is something that has been done because this is a highly infectious disease via touch. And there is something about if people are coming to sexual health clinics with symptoms that could be monkeypox, you might not want a whole waiting room full of people. You want the chance to speak to them first on the telephone or via email to check what exactly are the symptoms before bringing them to clinic. So that will have an impact on how we deliver sexual health.
I mentioned in the introduction you're a sexual health consultant, also specialising in HIV. I'm just wondering, are there any lessons that can be learned from the HIV and AIDS crisis that could help deal with and be applied to monkeypox? Clearly very different things, but I'm wondering if there's anything that can be applied.
They are very different, but you're quite right. What we must learn is about stigma. The very early days of what was called the AIDS crisis, which was HIV. There was all this labelling, this is a disease amongst men who have sex with men, or of course at the time the term was gay men. And that prevented people always accessing care and testing because they thought it didn't apply to them. And that's possibly why I'm being so very cautious about not over-labelling it. So there is lessons to be learned about not over-labelling, and if anyone has symptoms, then they should come forward. There's the part about understanding around funding. We're concerned in sexual health clinics is the adequate funding with real-time cuts over the past 10 years. And what has helped to turn around the HIV pandemic has been the amount of funding that has been available. So there are lessons about how we care for people, how we invite them to clinic, and funding service as well. And
we shouldn't be worried if people get monkeypox because it's not a serious illness. We need to reinforce that as well. Most people do make quite a quick recovery, don't they?
You're absolutely right there. Yes, for most people, it's self-limiting. It's the fact that it's so very highly contagious, and then there's a need to isolate, that means that we're being very cautious about it.
And I guess we also need to put this in perspective, as you rightly say. I mean, I'm reading that official figures show there were 57,000 cases of gonorrhea in England alone last year. I mean, there's almost, I guess this is the least of your problems in many ways, monkeypox, when you look at the issues surrounding sexual health in this country.
A very fair point. I think it's the impact on how we'll be able to deliver clinics that will make monkeypox so very important to us. That gonorrhea is on the rise, syphilis is on the rise, and that is at the forefront of the thinking of many GU doctors, and the funding to help us tackle that. But the fact that concerns about infectivity of monkeypox in clinic will really hold up how many people we can bring through clinic, which are, in the majority of cases, already running not far from a shoestring.
Thank you ever so much for speaking to us this morning. Grateful for your time. That is Dr. Matt Phillips, who's a sexual health consultant from the British Association for Sexual Health and HIV.